Okay, my name is Matt Genther, and I'm going to do a lung and thorax examination on our patient here. So before I do anything, I make sure that I would wash my hands and introduce myself. My name is Matt. I am a family nurse practitioner student. I'm going to do a thorax and lung exam on you today. Are you going to be all right with that?
Yes.
Perfect. Now that she's consented, my assessment actually begins when I walk into the room. I can just see how she's sitting. Is she tripoding? Is she having any trouble breathing? Is she using any accessory muscles? Using the intercostals, clavicular, anything like that, pursed lip breathing, anything like that, which I don't see. I don't hear any wheeze, but of course I'll be able to hear that much better when I use my stethoscope. So upon inspection, I'm just looking for symmetry and any strange, flailed chest, no paradoxical movements, which tells me that she's probably a little more stable here, so I can just do my regular exam. Okay, the first thing I would start with is we can do some palpation and then also feel for some tactile fremitus. So I kind of like to do those both at the same time. So as I'm going to start at the top fields, I'm going to work my way down symmetrically. I'm going to have her say 99.
99. 99. 99. 99.
And what I'm doing is I'm feeling for symmetrical feeling. If anything sounds different, I might double check that. Again, over here.
99.
And on this side.
99.
Okay, and as I palpate here, I'm looking for any crepitus or emphysema, air trapping under the skin that might represent trauma. Okay, after I complete that, I like to listen, so I'll auscultate her lung sounds. I'm going to ask her to take nice, even, slow, a little bit deeper breaths as I listen, and I'm going to work my way down in a symmetrical manner. Deep breath for me. I'm going to start all the way at the top of the lung fields as hard as I can. And I can check this middle lobe right here as well. Okay, so I had a nice vesicular sound there. If I were to hear any type of sounds that are unnatural, or wheeze, any sort of ronk or anything like that, I might do a further examination. So I'm going to percuss her lungs as well in the front fields. I understand that there are going to be some more dull sounds indicating that there are organs. We have our liver over here that I would expect. Right in here we have our heart, right about in front of her chest here. And then I would again get down to some tympany right where the stomach sits, the gas bubble. So I'm going to work my way from the top down. Okay, once I've completed the inspection on her front of her chest, I'm going to do the same on her back. Okay, so now that I have a nice view of her back here, I'm going to be doing the same percussion, palpation, and I'm feeling for tactile fremitus. So I'm going to have her again say 99.
99. 99. 99. 99. 99. 99.
Okay, perfect. Palpation for any air trapping under the skin, no crepitus or anything like that. Okay, next thing what we're going to go with is some auscultation. I'll have her again take some nice deep breaths. I'm starting at the top fields. I'm going to work her way down. I understand the scapula comes right in through my lung field, so I won't be able to hear anything around that. So I will avoid that. Nice deep breaths for me, please. Okay, again, I heard great lung sounds. No wheeze, no rhonchi, rails or crackles. Okay, now again, I'm going to go down. I'm going to percuss her back, and then by the time when I get down to the bottom, I'm going to have her hold her breath and exhale and hold that. And what I'm going to do that for is I'm going to see how much her diaphragm is moving, her diaphragmatic excursion. I want to make sure that it is one, even, and two, that she's getting that full expansion, so that way we don't know that there's something else going on here. So I'm going to percuss on the way down. And again, if I go over to the scapula, I know that's a much more dull sound. Okay, now I'm going to have the patient taking a deep breath and hold it for me. Okay, so I can mark right about where I heard that dull transition. With her shirt, it's going to be a little bit tougher, but I can just keep a mental mark on that, or I can keep my finger on it. And then I'm going to ask her to, again, taking a deep breath and exhale, but I want her to hold her exhale. So, go ahead whenever you're ready. And hold that exhale. Okay, so go ahead and breathe normally now. So I have my mark here on both when her lungs were full and when they were emptied, which I can see about how far her excursion was, which on my mark is about 5 centimeters, which is a normal finding. Okay, so the last physical exam I'm going to do here, I'm going to check her lung expansion. I'm going to have her hold her arms up a little bit, and I'm going to put my hands right around the 10th rib and kind of push them together a little bit. And now I'll have her take a nice deep breath. I'm looking for an even movement of my hands. Okay, so go ahead, take a nice deep breath. Okay, perfect, thank you, you can relax. So what I was looking for there is a nice even expansion, which I got. Now, if I hear any weird lung sounds or anything like that, I'll probably do some further testing. If she had complained about a cold or anything like that, as I was going over history, I would be checking a few other tests. I'm just going to explain them to you. You can go ahead and sit forward. So there's 3 that I would do. The first would be a bronchophony test, where I would ask her, like I did when I asked her for the tactile firmness, to say 99, but this time I'd be listening to her chest. If I heard it very clearly, then I would know that there's some lung consolidation there, and there could be just a little extra congestion. Whispered pectoralquy is another one that I'd be doing, where I'd have her just whisper maybe 1, 2, 3, 1, 2, 3, and I shouldn't be able to hear those if she's whispering, but if she has some consolidation, I'd be able to hear it pretty well. And then egophony is another one that I would ask her to say E. As she's saying E, it might sound more like an A when I'm listening. So those are just the few of the further testing that I would do if I suspected anything. But since she was clear and vesicular, I wouldn't have to do that. So I would thank my patient for letting me do the exam, and I'll see you again next time.